Ever wondered if you could break your penis? It might seem like an odd question, considering there are no bones involved, but the answer is yes, you can. Welcome to the fascinating world of penile fractures. A penile fracture isn't a fracture in the traditional sense, since there's no bone to break. However, it's possible to break your penis if it's subjected to a sudden and forceful bend while erect. This is due to the structure of the penis, which has two sponge-like columns or cylinders known as the corpus cavernosum and the corpora cavernosa. These columns fill with blood during an erection, and they're covered by a protective layer, the tunica albuginea. A penile fracture occurs when this layer is torn open. The frequency of penile fractures can be somewhat elusive. Some reports suggest it's rare, while others argue it's not uncommon. A contributing factor to this confusion is that people often aren't aware that a penile fracture requires immediate medical attention. The condition is more prevalent among younger individuals. So, how does one recognize a penile fracture? The symptoms can be quite startling. You might hear a popping or cracking sound, followed by extreme pain, an immediate loss of erection, bruising, swelling, and potentially blood in the urine or at the tip of the penis. The cause? Any blunt force applied to an erect penis that results in it bending. This can occur during sexual activity, energetic masturbation, or even an unfortunate collision with a wall or door. Diagnosing a penile fracture typically involves a physical examination by a healthcare provider, but additional tests like an ultrasound, magnetic resonance imaging, or a retrograde urethrogram may also be necessary. Treatment of a penile fracture usually involves surgery to repair the tunica albuginea with stitches. During this process, the surgeon can also check for and address any additional injuries, like a tear in the urethra. Recovery from penile fracture surgery can take a few days in the hospital, followed by regular follow-up visits to ensure proper healing and the absence of urination problems. Your healthcare provider will guide you on when you can resume work, school, and sexual activity. As for prevention, the key is to avoid intentionally bending your erect penis and to exercise caution during vigorous sexual activity. So while the penis may lack bones, it's still susceptible to its own unique type of break. And understanding the anatomy and mechanics of a penile fracture can help prevent this painful and potentially serious condition.